Namaste. Good morning. We welcome all the Vaidyas, dignitaries, and practitioners who are watching our today's talk session on the topic chronic kidney failure with the most renowned Vaidyas of present time. I am Dr. Gurmeet Singh Saluja, Product Manager at Shree Dhootapapeshwar Limited. So we are going to talk on the topic chronic kidney failure. We have, as we all know, this is a disorder which is mainly of the chronic nature, and the patients mostly are not able to the kidneys in the disease results because of the insufficiency of the kidneys to expel out the metabolic waste which is present inside the blood, and due to this insufficiency the patient manifests with many signs and symptoms just like the edema, pedal edema, facial edema. All these things are manifested in this disease, and the patient is required to continuously go through the process of artificial purifying, expelling out the metabolic waste in the form of the dialysis, which is presently available in the modern times. And many of the patients also opt for kidney transplantation, which is basically involved with many number of the complications in itself. So today we are going to talk on this topic. So what is the possibility of managing this disorder in Ayurveda? What are the different treatment criteria? What are the treatment modalities? What type of the medicine a patient is required to take? What is the type of the treatment a patient is required? So we are going to discuss on all of these topics in our today's talk session. Today's talk session, we have with us Dr. Professor S.N. Gupta sir with us, who is a renowned practitioner, clinician, academician, and above all Ayurvedic mentor of the present times, who does not need any introduction. So we welcome with us Dr. S.N. Gupta sir.
Thank you, Dr. Gurmeet. In my introduction, I would like to add few more words. Actually, my introduction is nothing but whatever I am because of this institute. I am proud to say that this is oldest institute of Ayurveda in western zone of this country, and it is established by inspiration of our most beloved patriotic leader Sardar Vallabhbhai Patel, whose birthplace is Nadiad. He has motivated Vaidya Sundarlal Joshi in 1938 to start some institutional training for Ayurveda. And from that inspiration of Sardar Vallabhbhai Patel, Vaidya Sundarlal Joshi has established this institute, which was started with few students in one rented house in the town, and now which is grown up in this huge complex where we have 100 students per year admission capacity in undergraduation and about 25 in post-graduation, and also in some departments we have PhD program. Together with this, we have collaboration with some renowned institute of Europe. So, as Gurmeet have highlighted some activities in our institute, we are very well known in the treatment of chronic kidney diseases, but also we have good success in cirrhosis of liver and other autoimmune diseases. So, I welcome you all in this very unique program which is organized by Dr. Gurmeet.
Thank you, sir. So before we begin with our today's talk session, let me give you a short introduction of our today's speaker. Dr. Professor S.N. Gupta sir is a professor of postgraduate department of Kayachikitsa at JS Ayurved College Mahavidyalaya, Nadiad, Gujarat, which is the oldest institute in Gujarat state, and he has more than 35 years of experience in teaching Ayurveda And as we know, this is the first institute which is NABH accredited in all over the Gujarat and all over the country, sir. Gujarat. Okay. And he has authored 2 books on Kayachikitsa and Panchkar, which have been published by the most famous medical book publishing company, Theme of Germany, and publications of about 60 scientific articles in national, international, and peer-reviewed journals is credited to sir. And he was awarded gold medal from University of Indore for his first rank in the final examination of Ayurved graduation, and he has been awarded Jugatram Vaidya IAS PAM award for excellence in teaching in Ayurved at BHU during an international enclave, and he has been awarded Fellow of Rashtriya Ayurved Vidyapeeth by RAV New Delhi. He is also awarded Excellence in Excellence in Integrative Medicine Research Award 2009 by the European Society of Integrative Medicine. He is a popular teacher among the students of India as well as abroad because of his good capacity to explain the ancient philosophy by using the modern logics for the students of the present times who are over fascinated with the modern science. And he is one of the authors and contributors in Charak Samhita new edition project at Florida, USA. And besides his academic achievement, he has achieved remarkable success in the management of diseases which are of chronic and obstinate nature, which includes diseases of kidney as well as liver, and with a research oriented classical approach. So as a result, the popularity of P.D. Patel Ayurved Hospital Nadiad has crossed the boundaries of the state and country, and having patients from all over the parts of the country and all the continents of the world. So as sir also informed, this is the first institute which is NABH accredited in Gujarat. So with this, I would like to start our topic of the discussion of today's talk session, that is chronic kidney failure. So our first point of the discussion is that, sir, what are the kinds of the modern day Vrakka Vikar, which is generally seen as per mentioned in Ayurved text?
So Dr. Gurmeet, as in your introduction, you have highlighted word chronic renal failure or chronic kidney failure or chronic kidney diseases. So, as such, we cannot say that this particular disease is related to kidney, because, in my opinion, kidney is not that much emphasized in Ayurvedic text as it is emphasized in modern conventional medicine. The reason may be different, but whatever diseases we see related to kidney, just for a moment we leave chronic kidney failure aside, but there are certain other diseases of kidney which we can correlate with our ancient disease entities. For example, Ashmari. Though Ashmari, which is described in Ayurvedic texts, are mostly related to urinary bladder stones. But if we want to treat them, even if there is renal stone, from same principle of treatment we can treat. So Ashmari is a disease which we can correlate with them. Then nephrotic syndrome, we can correlate it up to some extent with Kapha Shota. Of course, in treatment modalities, we have to integrate several other factors also. Just only on the principles of Kapha Shota, we cannot treat it. Then proteinuria or albuminuria, we can correlate with Sandramaya, which is one of the Kapha Prameya type. Then, for the information of our scholars, particularly youngsters, I would like to say that in Jora, you can find certain disease conditions which you can correlate with kidney related diseases. For example, in Jora, they have described one condition where patient may have blockage of urine and he may have shock. So that we can correlate with glomerulonephritis. This is just to imagine something.
Right.
And here if we see the treatment which is given in Charak Samhita, that is Gokshur, Bala, Yagri, that is Kantakari, Shunthi, and Gur. With these things, we have to process the milk and then it is to be given. So this preparation also you can use in this type of conditions where fever is associated with oliguria and some edema. So that in this way you can correlate. Then one wonderful thing that may be interesting for our youngsters, in Charak Samhita, Chikitsa Sthan chapter 20, they have described one condition. It is chapter related to Chardi. So there they have described one condition for Ashadya Chardi. That means a condition of Chardi disease, vomiting, which is incurable. And that is very peculiar picture of terminal condition of uremia, if you see this. And in those days, Dharbal, who is the author of this chapter, might have observed that in this condition, with that time, the treatment which was available in that time, they could not succeed. Today, you can send the patient in dialysis and you can save the patient. But in those days, it was not possible to save the patient. Therefore, they have declared it as asadhya. See the description. Vitu sweda mutrambu vahani vayu. Srotansi sarvudhi yad urdu mahti. Ussanna doshasya samachitam tam. Dosham samuddhiya narasya kosthar. Vin mutriyo tad samgarna vandam. Gandham. Tad swasi karti yutam prasaktam. Prachardiyed dushtam hi ati vegat. Vegat taya arditas chasu vinashameti. Taya ardit means in this type of condition, if one is suffering, then ashu vinashameti, that cause the death. And symptoms, vinu sweda mutramu vahani, clear. There is obstruction of purish, stool, swed, mutra and udar. Means all water and electrolyte system is deteriorated. And patient may have vomiting in which he may have smell like stool and urine. This is peculiar picture of uremia.
Right.
In which vomiting, even the breathing, smell urine. So clinically, Dharbal might have observed that if patient has this type of condition in which he is not passing urine, he is not passing stool, he has excessive thirst and then he suffers with hiccup, breathlessness and then having smell like urine, then it is incurable condition of Chardi. That means it is terminal condition of uremia. So that also we can understand that in those days, this type of condition may be present, but they considered it as incurable. Then polycystic kidneys, we can correlate with different type of granthis and tumors. And on that line you can treat also. Then there are some congenital diseases or hereditary diseases like Alport syndrome. Those you can correlate with Bij dosha. And then autoimmune diseases. Later on I will also explain in detail when we will proceed in your interview that autoimmune conditions of kidney we treat with the principle of treatment of hormone. So in this way we can correlate certain renal condition or in general urinary condition. But as your concentration is more on chronic renal failure we cannot correlate this with any condition described in Ayurveda. Often, just for the sake of vitanda, people try to say that it is mutra karsha, mutra aghat. No. You cannot correlate the condition of chronic renal failure with any kind of mutra karsha or mutra aghat. These conditions can be causative factors for chronic renal failure. But you cannot say that this type of mutra karsha or this type of mutra aghat we can correlate directly with chronic renal failure. And for that we should not hesitate to say that this disease is not directly described. Just to make it more clear, when we started treating these type of patients in our hospital, I tried to search very intensely that in what ways the Ayurvedic Vedyas consider this disease, but I could not find it. Then I started experimenting myself and we set some design of treatment to treat this.
Thank you, sir.
If you have any counter question, you can ask.
Sure, sir.
Our purpose is to give more and more information to the interesting people.
Sure. So that means as you've explained, given the quotation of the Charak Samhita, so we can say this is the specific signs and symptoms which you have just mentioned, which are found in that Chhardi road, which is of asadhya condition. But that is actually a pratilom gati of Vayu only, I would say.
See, there they have used one word, that Ussanna doshasya, means the person who is already suffering with Ussanna doshas, means he is already having some primary disease. So there it is not primary disease, it is secondary. Means primary disease must be something else.
Right.
So from that we can conclude that Dharbal observed that person who already suffer with some disease, if he has this type of condition, that is asadhya. That means patient is entering into terminal uremia.
Thank you, sir. Our second point of discussion is, as we know that you have lots of patients who are visiting you for this kind of disorder. So, what are the general Purva Roop and Roop which you see across these patients when they visit to your clinics?
As you know, chronic renal failure is secondary. Primary diseases may be diabetes, maybe hypertension, maybe glomerulonephritis, maybe polycystic kidney, or several other conditions. So when patient comes, then he already comes with the features of chronic renal failure. There you cannot say that what type of Purva is there for chronic renal failure. You can consider the primary disease as the Purva or Nidanarthaka Roga. If some patient is diabetic, I give you some example because it is not exactly that as we are habituated to see in the text that Purva Rupa, these things. In this way, there is nothing described. But if some patient comes having diabetes, often we observe some specific type of change in his facial prabha. Prabha is going towards chaya, abnormal chaya. And in those patients, when we examine his renal function, often we found that yes, there is some deterioration in his renal function. So if patient of diabetes, hypertension, or any other chronic type of disease, in them, because I cannot describe it at what type of this. When we will go in the ward, I will show you particular features of this type of chaya. From that you can judge that if this type of chaya is developing in the patient, from that you can just infer that this patient may go into this condition.
Right.
And we often predict also this, that even today your creatinine may be normal, but in future you are susceptible for this condition. And we observe that it happens. So this change in the Chaya from Prabha to Chaya, we can consider as very important sign in having this pre-diagnosis of this condition.
Sure, sir. So this means that the study of Prabha and Chaya plays an important role as we study during our textual references, So this plays an important role because as I know that so many patients who are of younger age also,
yes,
they visit your clinic and they are suffering from this chronic kidney failure. So I think that they are not suffering from diabetes and all these conditions, but of course we say that some Bij Drushti or any kind of condition is maybe lying there.
Yes.
So what are your views with regards to these younger patients which visit your clinic?
See, younger patients, now there are certain Ayurvedic views about this. We may say that younger patients may not have some mithya ahar vihar, etc. They may have, particularly in modern time. Particularly the children, they are not very much towards healthy food habits. Modern time children, particularly in our country, now they are going for more this junk food. So we cannot say that children are not taking any type of abnormal ahara and vihara. But if we say that yes, child is taking very healthy food, then there may be some problem with ahara and vihara in the mother, in the father. That may come through their bija in this young boy or young girl. This may also be possible that father, mother, parents are very punctual, very regular, very health conscious, but still child is suffering with this disease. Then in Ayurveda, still they consider Deva. Adrashta karma, adrashta upchar. That may be factor. Science may not consider this.
Right.
Because for science, anything which they can explain is a fact. But as Ayurvedists, we should not hesitate to consider these factors. Because Deva is also one of the important etiological factors. To understand this simply, I give one example. What is the role of Deva? Suppose there is some patient of lung cancer. He is a heavy smoker. Any oncologist will say that this is the cause of his lung cancer. But a person who never smoked, in whole family nobody smoked, living very ideal lifestyle, and he suffers with lung cancer, then what will be the cause? Science will say cause is unknown. But we in our philosophy say that without karana, there cannot be any karya. Without cause, no effect. So cause must be there. So Ayurveda here say Deva is the cause. And therefore in Ayurveda, often people talk about Yukti Vyapashraya treatment. But here in our hospital we consider Dev Vyapashraya, Yukti Vyapashraya and Sattva Vyaya equally. We do not ignore. When we talk about holistic, we forget our own holism in the treatment approach. So here in such conditions, as your question was related to young children, how do they suffer? So if there is no obvious cause related to their present life, then the cause may be related to their previous life.
So that is very correct actually, I would say, because as during my visit to this college campus, I saw that the students are also focusing on the Kayachikitsa part of the treatment. So this is also very important as per Ayurveda, which
You also
unfortunately,
saw we are performing yajna.
yes, sir. Yes. So that is what I saw in the institute, that students are also learning how to perform the yagna. So this is very beneficial kind of a sattva chikitsa for these kinds of patients. Then,
Though it is out of context, but I would like to say here and mention here, because this is also related to our present day problem of pandemic. We did not close our campus totally during this whole pandemic. Because when pandemic started, we had patients from several parts of the country. We could not immediately relieve them. We continued their treatment here and gradually we relieved them. As soon lockdown was stopped, again patients started coming. Then students started coming. So we never closed our campus totally. But every day we perform all our rituals related to their past. And I am proud to say that not a single serious incident related to corona happened in our campus. So we have not to ignore the power of Devya Past in Ayurveda.
that is a very remarkable achievement in this institute. Then coming down to the next point of discussion. So as we know that the patients who are suffering from chronic kidney failure needs to be diagnosed from the modern perspectives also. So our next point of discussion is what are the different pathological tests which we consider for diagnosing this disease.
Yeah, when we suspect that this patient may have problem related to kidney or urinary tract injury, so we send the patient to the laboratory and primarily we investigate his serum creatinine level, his electrolytes, his blood media, his hemoglobin. And if they are abnormal, then we say patient that you, according to the level of these biochemical components, we saying that at which level you are in your disease. And then we advise that what type of treatment you have to take.
Thank you, sir. And coming to the next point of discussion, as sir has already mentioned that we cannot correlate this chronic kidney failure with any of the disorders mentioned in our Ayurved text. But still, I would like to ask sir that sir, what are the different diseases mentioned in Ayurved text to which we correlate this and try to bring a particular specific treatment protocol for chronic kidney failure.
Can you make it more clear?
Sir, just wanted to ask you that what is the treatment protocol which we follow as per Ayurved text?
See, here one more thing I will like to add, that we often very much attached with our ancient text. We have to realize certain things that even in text they have clearly mentioned that whatever is described, it is very limited. And only to just give you some guidance, you have to explore with your own wisdom more on this. We have a tendency that we always try to stuck with the classical description. Of course, that is biggest tool, but it is not only thing that we have to follow in the practice. Often people talk about classical text, but Gurmeet, I just ask you one question. Up to which extent you consider the classics? Only Bhratrik? Only Lagutrik? Then, if you consider only these six, then what about Rasosdis?
Right.
And I often ask the people that when a person of Kushta comes to me in OPD, what is usual treatment you give? Usually, Manjishtadikwa, Keshav Ruddu, Gandak Rasayan, Arod Varni, etc. etc. Tell me, where in the Bhratri it is described. So when you practice, you have to see practically what is more relevant, what is more possible. So as I told you in the beginning, that when I started treating the patients up, I tell you it was first patient who came to me with chronic kidney failure. He was very poor patient. In urology hospital, they told that you need immediate kidney transplantation. You have to decide within a week, otherwise there is no possibility. And that poor boy did not have any resources. He came to me and I was not very well aware that how to treat such patients. I also tried to just go through the pages of the text and everything. Even in Bhesaj Ratnavali, in its appendix, they have mentioned a chapter for kidney disease. That also I have seen. But I could not find that directly how I have to approach. Then I thought that in Ayurveda they have told that if you do not find a description of any disease in the classes, your approach must be according to the dosha involved, dusha involved, slotas involved, where from the disease originated, what is its utthana, what is the status of Agni. With all these factors, you design your own treatment. So, then I saw that the main problem here is related to slokas, Mutravaha slokas. There are abnormal changes in the structure of the slokas of Mutravaha. There is excessive kharatva, gurutva, rukshatva in the slotas, Mutravahani slokas. So, how we can revert these pathological changes? Pathological changes not according to conventional science, but pathological changes according to Ayurveda. Kharatva, Kaఠિન્ય, Rukshatva, Gurutva, etc. So you have to find the medicines which can produce the reverting properties in these pathological factors. Then another thing, dushas. So basic dushas may be mutra and directly related to it, udak and sweda. But later on, nearly all dushas involved. So that also you have to consider. According to that, you have to design. And in this way, what we have designed, that most important principle in Ayurveda is Nidana Parivarjana. So besides all Ahar Vihar related Nidanas, you also have to consider Nidanarthaka Rogas. So Nidanarthaka Rogas mostly related to diabetes, hypertension, glomerulonephritis, polycystic kidneys. So treat them. This is one thing. Then all the rasayanas, those are having beneficial effect on Mutravaha slokas. Use them. Then dushas, according to dushas particularly, Rakta is diminished here, Mamsa Dhatu is diminished here, Asti is diminished here, Shukra is diminished here. So according to that, you find the treatments which can act on these dushas. And then whatever other conditions associated, for example, patient also have secondary insufficiency of heart, treat it. There are symptoms like nausea, vomiting, treat them. So some symptomatic relief and then the attack on pathological factors related to slotas, doshas and dushas. This is general structure. And together with this, as I told you in the beginning, most important is Devyapasana and supply. When patient goes to a nephrologist, he gets negative information. You do not have much time. Go for dialysis immediately. And after certain period, you have to go for kidney transplantation. This much the expenditure, this, etc. Now patient is frustrated. Even a higher middle class patient is not able to go through this type of treatment. So you start negative thinking that what will happen to me, what will happen to my job, what will happen to my family after me. And Vishado Rog Vardhana Charak Sanhita says. This type of frustration lead to more severity in the disease. So what there Sattva is needed. What is Sattva? Ahitebhyo Artebhyo Mansa Nigraha. Whatever is harmful, object of mind. Mind's object is thinking. So whatever negative thinking is there, that you have to stop. How to stop? Here in this hospital, there are several levels of Sattva. Some are passive, some are active. Passive, patient comes in the OPD. Other patients of renal failure are sitting. They talk together. What is your problem? Oh, I am suffering with kidney disease. Since how long? Oh, since 2-3 years, but here I am since 3-4 months. How do you feel? Wonderful. Doctors told that you will survive only this much, but now I am happy. My creatinine is maintained or going down, and I am feeling much healthier than before. Now, patient who is coming first time, he will get encouragement. That means I will also have energy. So the negative thinking is now transferred to positive. Then he comes to us. We also try to assure him that of course disease is very big, problematic, but we have treated the patient of this disease and we have quite good success. We can help you a lot. He gets another assurance. When we hospitalize him, after 1 week his creatinine goes down, then again he feels, oh, now I am better. So in this way, he gets support there. Then we say that we do, in Ayurveda, they have past statements, they have given a list. Mantra, money, upahar, bali, etc. But just for practical purpose, whatever belief patient has, religious belief, because even in Hinduism there are several beliefs. A person who is following Krishna will not follow whatever you see related to Shiva. So I asked them that which God do you believe? They said this, okay. Then whatever prayers you are performing, intensify it. If there is some Muslim patient, I say perform 5 times namaz. If Christian is there, I say go church regularly. And wherever you are free, pray to God. So this is just to boost their faith in God. That also creates positive thinking. So this is also an integral part of our treatment style.
Thank you, sir. So the conclusion of the sir has what sir described is that the patient should not be made fearful.
Yes.
Instead, he should be counseled, encouraged that how he would perceive the rest of the life and come out of his disease positive. So this makes it the patient feels more positive and encouraged. So coming down to the next point of the discussion. Sir, I would skip a question now because it's a use. We will discuss it later on. But first, we'll come down to the normal signs and symptoms which we see in the patients.
Yes.
Sir, what is the normal urine output and of the patient? How can we diagnose and predict the severity of the diminished urine output?
Yeah, usually see urine output is also one of the factor. Oliguria is one of the factor. But you may see sometimes that patient may have no oliguria, rather big amount of urine. But still, oliguria is one of the criteria. Other features that patients complain of, some unexplainable weakness. He is suffering already with some disease like diabetes, hypertension, etc. And then he says that since some period I am starting feeling weakness. Then a kind of anorexia, nausea, vomiting, sometimes breathlessness, particularly when he has some efforts. So these are the features. And as I mentioned, change in the chaya. If these features are there, then we can suspect that he may have renal insufficiency. And then we investigate and then we confirm.
Thank you. So certainly, as again sir has mentioned the role of chaya. So of course we will be going to see the various kinds of chaya when we will do the follow-up of our patients tomorrow in the OPD. So if we continue with our next question. Sir, as per the modern drugs which most of the people are continuously taking nowadays, like the painkillers are there, so much of the misuse of the painkiller is there. So what according to you are people who are taking the modern drugs which are causing harm to their kidneys?
Yes. See, in this category, very big group of non-steroidal anti-inflammatory. These medicines are so freely available throughout the world, even without prescription, that whenever somebody has some kind of, everybody has some kind of, because of overstress, over-exertion. And patient, in spite of changing the lifestyle, try to manage with some pills. So they take some of these drugs, and long-term consumption of these drugs is causing this problem. Then certain antibiotics, they are also causing renal damage. Then some blood pressure medicine, for example ACE inhibitors, they are also described as affecting the kidneys. Then the chemotherapy treatments which is used in cancer, they are also causing damage in the kidneys. Then for some investigative procedures, the chemical dyes which are used, they are also having nephrotoxin. During this corona period, you might have heard about some antiviral, they are also nephrotoxin. And in this context, I would like to say that these drugs are found nephrotoxin. But we observed that when patients were given Ayurvedic treatment together with these treatments in corona, their kidneys were not affected. Even in the patients, those were suffered with kidney problem, and we were afraid that all these remdesivir type of drugs may cause more damage in their kidneys. But we found that no, these have not caused any further damage in the kidneys when they have taken Ayurvedic treatments together. So this gives one hint that Ayurvedic medicines are protective to kidneys.
Thank you, sir. Now coming to the next part of our discussion, now we will start with the approach towards the diet which a patient needs to take after he gets diagnosed with this chronic kidney failure. So, sir, what should be the diet given to the patient with the Brugge-Vikar, especially the raised creatinine level? What should be the water intake and salt intake, etc.?
See, water intake we decide according to his urine output. We also try to avoid taking much liquids so that kidneys may not have burden. But same time, there must not be dehydration. So we have to watch the patient that how much hydration they need and how much they have to excrete. According to that, we have to judge the amount of not only water but all together the liquids, because we also give several type of decoctions. So that amount we also have to consider. About salt and these things, we have to see the status of their electrolytes. And according to that, if sodium is high, you have to restrict the salt intake. The patient also have hypertension, or if he has cardiac failure, then we also have to restrict the salt. Potassium is very important in these patients because very sensitive. So if patient's potassium is high, he has hyperkalemia, then we ask the patient not to take fruits. And if vegetables also, vegetables are necessary. So what we do that we ask the patient to boil the vegetables, then squeeze the water from them and then take them. So the big amount of potassium can be eliminated from vegetables. So this is how we try to manage the patients with hyperkalemia. If patient has low potassium, then we encourage patient to take more fruits or coconut water. Then about other food items, we do not give any grain than the rice. Because here we have to consider what Ayurveda considers is best. Hitatama. So there is list that which thing is hitatama. So that we have to choose in these patients. Because anything which is slightest ahitkar can be harmful. So in grains, we always ask the patient to take rice. Sometimes, just for the change, we allow them to take java, barley. But we never allow them to take any other grain, like wheat or millets, etc. In the beans, we always prefer to give them mungo beans, because this is considered best among the beans in Ayurveda.
Right.
Then in vegetables, I found that all vegetables from Cucurbitaceae family are very good for these patients. And there are big number of vegetables from this family, and they are easily available in the market. So that we recommend to them. Milk, always we recommend cow's milk. 300 milliliter to 500 milliliter per day they can consume. Then we also ask them to take a good amount of cow's ghee every day. Because as I mentioned you that in their slotas there is kaఠిన్యం, rukshatva, and ghee is mardavakara, mradu, snigdha. So to counteract these pathological changes in slotas, this we have to compensate with the diet factor such as ghee.
Thank you, sir. So with this, we will take a short break, and we will again come to this topic of discussion, that is chronic kidney failure. So please stay tuned. We will again back to our session. Thank you.